people now and for several years have been talking about depression, experiencing depression, being told that they have it, being told by others outside of themselves what they are experiencing, being told that they have a problem, that they need something outside of themselves to fix for them. Many people have gone for help when experiencing what we used to call low spirits, or feeling down, or sad, or grieving, or depressed, and have been bum rushed through a doctor's office, handed a script, and boom, boom, boom. 15-minute, 10-minute office visit. Some of these people have come to me later and said, I don't feel better. As a matter of fact, I feel worse. I don't feel my feelings very well, any of them, happy or sad. And furthermore, I'm having some physical symptoms as well that are making me very sick, and I'm alarmed with what I'm experiencing. If I'm working with a person who's been through that mill, then we're going to find a medical professional who is reliable to help monitor this person's condition, because I am not a medical professional, so that recovery from the products they've been using can be as safe and effective and timed properly for that individual's best health. That's a guarantee. If that's in the works, that we will collaborate with a healthcare provider who is skilled and competent to help that individual. Now, for any and all of us, what is depression? What are we experiencing when we have depression? It can be due to a physical condition. And I don't mean some deficiency in the brain. I mean like liver trouble, heart disease, nutritional inadequacy. Often it has to do with what's called dysbiosis of the gut, meaning that the right culture in the gut is not there. Studies have been done to demonstrate that the communication between the brain and the gut, it goes both ways, but that the gut affects the mind even more than the brain affects the gut, believe it or not. So we look into these things and see what needs to happen there. Now, beyond that, if I'm feeling heavy in my heart, the human mind works by metaphor, otherwise known as storytelling and symbolism. So if I feel heavy in my heart, that is, I'm depressed, what is it that I'm carrying? How long have I carried it? What does it mean to me? What beliefs do I have associated with this heaviness, this depression, where I feel pushed down? Am I pushing something down inside of myself because someone taught me that I wasn't okay to be me, so I'd better push it down? These are all valid questions, and we can examine them. There are many different ways for each unique individual to approach what his or her experience of feeling very sad, very low, low energy, depressed can be. The most amazing emergence from examining depression often is that it isn't really a problem at the root, but rather a treasure that we're carrying around disguised as a problem because we have been told that we're not okay to be how we are. And I know you're saying, Dr. Baker, I can't get out of the bed in the morning. I feel like hell. I've put on weight. I avoid people. How in the heck is that some kind of treasure? When we learn how to talk to other parts of yourself through the skills of active imagination, we find out what is this other part of you or parts of you that somehow you got the idea aren't okay, who literally feel sad inside of you and are trying to get your conscious self's attention so that you can be a whole person, enjoy your life. When I was in my 20s, I went through a very severe episode of depression after I lost the social network suddenly to which I was accustomed. And I began to read and examine what is it about being depressed. And I remember coming upon a phrase, if is your heart heavy, would you rather it be empty? We have moved into an era of society for some time now where people are given the bum's rush. Hurry up and do this, hurry up and feel better, produce, produce, produce. You know, if we approach little children that way and we don't appreciate them for who they are and we're always trying to get production out of them, they get sad. They're unhappy. Why would we think that ourselves are any different? There's a lack of patience with the human process. Get them, process them through, ka-chunk, ka-chunk, ka-chunk. Working with depression successfully with the right kind of skills, which include EFT or meridian tapping, matrix reimprinting, which is a form of active imagination that helps you to effectively change your inner emotional climate in a way that works for you. Dream work, uh, various kinds of body movement and breathing. We can do all of these things. I've been around a long time. I have a large bag of tricks that really work for people. Um, this takes time. This takes attention. This takes being attended to, listened to, appreciated. We look at characteristics in you that maybe you have thought were not so great, but turn out to be your best friends. And then one day, after persevering and stumbling and persevering and stumbling and persevering, you begin to find out that you are becoming your own really best friend. And when you have a best friend you like to play with, even if you're sad, the sadness doesn't knock you down. You can have your feeling of disappointment and sadness, take a breath, and then be here in life for the next fresh moment. It's possible. We can do it.